welcome back to Body Beautiful. Today we have with us Dr. Joseph Mele, plastic surgeon. We're talking about breast augmentation and breast augmentation revisions. Okay, let's just go to the phone lines again because we are really short on time. Sharon from San Jose. Good morning, Sharon. You got a quick question for the doctor.
Yes, would high altitude cause a breast implant to inflate or expand to the point where your original incision split open?
No, no, it certainly won't. In fact, I not to make light of your question, I actually wrote an article April 1st of last year about that exact question, because there's always some story in the news once in a while about an implant exploding from someone getting on a plane. Our whole body expands a little bit when we go to altitude, and the implants don't expand any more than we do, so you should not really even notice that there's a change there.
Okay, but they can rupture, right?
Implants can break, but not usually from getting on a plane. Usually if there's trauma, it's more like you were in a car accident and got smashed. It's a lot of trauma. It would have to be very trauma,
not just
but sometimes
playing sports.
They do just wear out. So there are some times when the implant shell will fold and it just keeps folding and wrinkling and wrinkling, and eventually it'll crack and then it'll leak. So sometimes it just seems spontaneous. But going up and down on a plane really isn't a lot of stress for the implant.
Okay, all right, well.
Or even going to Tahoe and skiing. The skiing itself might be more of a problem.
If you were to hit
if
something.
If you hit something hard, yeah.
Okay, Sharon, thanks for your question. So if we were talking about some of the potential problems, rupture.
Sure. So rupture, the implants can leak. It's a man-made object, so it can wear out. The scar that normally holds the implant in place, and it's important. We need that scar. Without it, the implants would drop like that last picture. Sometimes that scar gets too vigorous or too hard. Those are probably the more common reasons that would go back.
So when somebody comes in, they decide to have it, how much downtime can they expect, or can they get right back to work?
You know, it depends on what they're doing. You know, if I have a patient who's working for a parcel delivery and needs to lift 100 pounds, it's going to be a few weeks before they can get back. For folks who are doing normal stuff around the house or lifting less than 30 pounds, they usually are back doing what they need to do within a week or so.
And that revision?
But there's variation. I mean, I'll have some patients where 2 months out, they're still very sore. That's really unusual, but you know, for that person, they don't care how unusual it is. They just want to be better.
Yeah.
And I have other folks who the day after surgery are just doing everything they're not supposed to be doing because it doesn't hurt.
Right.
So somewhere in the middle is safest.
Okay. Doctor, it's always great to have you on the show. Unfortunately, we are out of time. We can't take any more phone calls, but for more information about Dr. Mele, you can call his office. That number is 925-943-6353, or go ahead and check him out on the web at drmele.com or sanfranciscobreast.com. Thank you so much for joining us, Doctor. Thank you for joining us. Have a great day, everybody. Bye-bye.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.